Good afternoon, everyone. This is James Powell. I am the VP of Practice Development with DocLoop. Thank you for taking the time to play this call today on genomic testing with DocLoop. As far as other presentations I have on our platform in general that walks through everything, I have one on that, have one on the FAQs. So I have other presentations if you'd like those and have not seen those yet. Today, I'm specifically going to be talking about genomic testing. Our platform is designed to be one platform for every workflow. That would include genomic testing. It's specifically designed for precision medicine, for longevity practices, for any kind of a cash-based practice, hybrid model practice, concierge type practice, age management, anti-aging, whatever you want to call it. So I'll get into the details of what our platform does to make this truly, I think, a game changer in longevity programs and how we make it much easier. So why is genomic testing so important? Well, we'll take a look at what I call the 3 Ps: predict, personalize, and prevent. Even in my own longevity program as a patient, I've been on one for about 17, 18 years as of this recording. It is no doubt genomic testing through DocLoop was one of the most profound and important things I've ever done to enhance my outcomes and truly lower my risk factors for future disease. We know we can predict what someone has the predisposition for with all types of medical diagnoses, all the common causes of death and cardiovascular and Alzheimer's and cancers and things like that. We can predict. As long as you can predict that, which you can with genomic testing when it's done correctly, you can now personalize your protocols, whether they're based on dietary protocols, depending on what your genomic profile is. There are certain ways you should be eating or not eating that can greatly impact your future propensity for one of these disease processes or issues. Exercise can play a role in it. Supplementation. In fact, in our protocol, you'll see in the platform, you can order supplements and everything based on your profile right there in the platform. It does everything in the same platform with DocLoop. And there's some specific things you can take supplement-wise to help prevent disease. So it's all about whether it's prescriptions, whether it's hormones, whether it's supplements, whether it's lifestyle modification. The whole idea is to prevent some of these things from happening, and we can control our destiny regardless of what our genomic profile predicts. Why is it, again, so important? Because medicine has been moving for a long time now. I've been involved as a course instructor with one of the largest certification organizations in this field for close to 20 years now. And it's been moving, medicine has been moving away from being reactive to more predictive and preventive. Genomics can reveal your long-term risk factors long before any symptoms or issues would appear. It allows you as clinicians, whether you're a physician, a practitioner, it allows you to personalize every decision you make, enhancing the protocols to get the desired results the patient's looking for, feel better, function better, be healthier, have a better health span, and yes, dramatically reduce your long-term risk factors. It identifies your biological predispositions. It can refine your programs that you have patients on, again, in the areas I mentioned just a few minutes ago. It improves outcomes and longevity, your metabolic health, your brain health, all the common problems of aging, and again, quite frankly, all the common reasons that most people die, the common causes of death. It can enhance your compliance and retention. In fact, genomic testing, like I'll talk about here in just a minute, I really think is important in not only everything I've mentioned so far, but also in reducing kind of hit or miss protocols. You can really hone in on what is most relevant for that patient. It says the gap in traditional genomic reports. So there are a lot of genomic vendors out there. I wouldn't say they're quite a dime a dozen, as the saying goes, but they're getting close to that. I've had one done in the past. It was very inexpensive. It told me a little bit, quite frankly, not much. But one done correctly, the reporting on it can be 70, 80, 90, 100 pages of unfiltered data. In fact, I recently spoke with one of our medical board advisors with DocLoop, who's very experienced. All of our medical board has, on the average, 15, 20 years or more experience in growing longevity practices, which is why they're on our medical board. And I talked to one of our physicians recently who went to an entire 3-day workshop on reading genomic reports. It's 3 whole days. He said it was helpful, but he concluded it's so complex, and at the very minimum, someone who's experienced in genomic reports would probably spend an hour, maybe 2 hours sorting through it, even to make a determination on what protocols to actually take with their patient. So it can be very difficult, complex, and time consuming. There's usually no clinical prioritization or clear action steps. At the end of the day, when you look at genomics, a genomic report on someone, what is the action plan? What are the steps you should be taking? How do you implement a clear, precise plan for that patient based on their profile? And that can be, again, at the very minimum, very time consuming. And worse than that, sometimes it's just confusing. It's hard to get together the right actionable steps. It can be a little bit overwhelming. So, how does DocLoop close the gap in this complex process? Well, everything is in one platform, first of all. Our mantra here at DocLoop is one platform for every workflow. And again, that would even include genomics. We've even simplified, and we do all the heavy lifting with genomic testing. So anywhere from the ordering to having the kit sent out, tracking for that, when the results are in, all on the platform, we can schedule that. We do a 3-way call between a specially trained PharmD, that's a PhD in pharmacy, who's specially trained in genomics. There's a call with them and the doctor, of course, you, the physician or clinician, along with the patient. So we do that part for you. There is in our platform, it's fully integrated, but also AI powered. It can translate a lot of the raw data. Plus, we have the PharmD who goes through and spends all the time you would normally have to spend in assimilating that data, and it comes together with a Cliff Notes version, a clear, concise report that's reviewed on that phone call, and you will have an action plan. Again, in nutrition, exercise, supplementation, any prescriptions or hormone therapy, any other kind of medications that would be warranted based on their profile. And of course, you, the physician, retain editorial control, but all of the work is done for you. You virtually don't have to lift a finger in the process, other than we recommend that you are on that call with the PharmD and the patient. In fact, quite frankly, you don't even have to be on that. We certainly recommend that. Most physicians or clinicians would want to be on that call. The end-to-end genomics process through DocLoop, all of this again done in the platform. Order the test, patient receives the kit automatically. Usually around 4 weeks, the results are in. We set up that phone call, and again, all this, including setting up the call, all that can be coordinated through the DocLoop platform. It all has an automated calendar with AI, and there's integration, and there's the ability to set that up quite easily. Once we set up that call, DocLoop delivers a prioritized report with insights, and that protocol that we set up for you, all that's delivered to you. You also have a record of that in the dashboard, of course, and then we do that phone call. It can be done in person or by Zoom, whatever your preference is. It's simple, it's automated, it's patient friendly, and on that phone call, the patient will be given specific recommendations and directions on what their best course of action is, specific lifestyle modifications, whether there's supplements involved, and there virtually always be some supplements based on their genomic profile. And sometimes, of course, prescriptions are recommended. And then the fulfillment of ordering those supplements and any prescription items can all be done right there in the platform. So the patient is explained these protocols, what their recommendations are, and their questions are answered. They say yes, yes, of course they want to take care of these things and lower their risk factors. And right there, basically in one click, order fulfillment can be done. So we take that 80, 90, 100 page report, as I said a few minutes ago, you get a Cliff Notes version. Of course, the patient gets that. So we basically hone down to exactly what the patient needs to know, what you need to know for your patient. All that full report analysis is done already behind the scenes. Again, we do all the heavy lifting, and it culminates with that individualized plan in those various areas. So you get clarity, not clutter, in a very time efficient manner. So, as I said before, we schedule that call, that three-way call, Zoom or in person, whatever your preference is. We walk through the results. The patient is explained their various risk factors, which everyone has some, the specific recommendations. It strengthens the credibility and confidence. I can't even imagine now, based on what we do, how you would take an 80-page report and try to assimilate that and conduct your own phone call if you didn't have a platform like DocLoop. I know it cannot possibly be time efficient. In trying to explain this, when let's be honest, it can be very confusing, these reports, even for a qualified clinician, or even if you've done these for, can you imagine how confusing this can be for the patient? It's no wonder they would usually culminate with their phone call if you try to do this on your own with questions more than you can handle on one phone call, that they probably want to go think about it for a while, not sure what to do. But with our process, you can almost guarantee that phone call concludes with order fulfillment, ordering what they need, why they need it. They know exactly why, what they're on, what the protocol is. The order is out, they get a tracking number, and it now goes on autofills every 60 days. The follow-up calls you'll have with them is all done in the platform. Everything is coordinated with any other data you have on them, either any other diagnostic test. All that data is in the platform. Any other regular lab work you have done, maybe you're doing quarterly labs like I still have done. All of that's coordinated in the same platform. We do all the heavy lifting. You don't have to spend all the time required for you to try to analyze this and put together the plan yourself. As I've said, order fulfillment done. And I don't just send this out to anyone, but when we're talking about genomics today, we have all the dozens of supplements related to genomic profiles. I send these to our clients, a full list of these. Of course, you can order them right there with one click on the platform. But you will see exactly what cost is. You'll see what the suggested retail is. You can make adjustments if you want to. You'll see exactly down to the penny what your net profit is. Actually, you see what DocLoop makes, what you make, all of that full disclosure. We give that to all of our providers. Now, your patients don't see that. They see what they need. They see what the cost is. It's all competitively priced, but you'll see exactly what you make, because at the end of the day, other than achieving superior clinical outcomes for your patients, it needs to be profitable. It's time friendly, it saves you and your staff time. You see exactly what the margins are, etc. And then all of that's tracked moving forward. There's predictable revenue per patient on this. In a nutshell, I'll tell you exactly what you make. You make $500. Physicians or clinicians, if you're listening to this call, you make $500 for sitting on that phone call. So you order the test, it comes in, we schedule the call, you sit there, the PharmD basically does the call. You can chime in if needed or wanted, but you make $500 every one of these tests that you order. As of this recording, now that could change, but I'll tell you right now, as if this recording, what the patient would pay for this genomic test to have everything done for them, all the protocols lined out, action steps, etc., is $2,700, $2,700. There's some out there less expensive. There's some tests more expensive, but for everything they get, There's over 700 of these SNPs that we check for. And again, in this case, with us, with DocLoop, they get in writing their specific action steps. All the heavy lifting is done for you and them. And then right there in the platform, we can go ahead and do the order fulfillment for prescriptions and supplements. So they pay $2,700. This test more than pays for itself by reducing trial and error. Of course, you know, genomic testing only has to be done one time. Unlike regular lab work you might be doing on a quarterly or semi-annual basis with your patients, whatever your protocol is, and you make $500. And more importantly, now the ongoing revenue share. Even with pharmacy items, prescription items, we put them in packages. And of course, the patient pays for that package. And of course, built into that package is your clinical supervision, your medical management, if you will, your physician time or practitioner time is all built into that package. Therefore, we can charge for the package. We're not charging them just for a prescription item, which we're not able to do. So you make the money in the package. And then, of course, with supplements, non-prescription items, we're allowed to charge whatever we charge. You can charge the retail for that. There's a margin built into that, and you will now make ongoing profit margins on those packages or the supplement items ongoing. So there's a higher lifetime value through these personalized long-term care plans. You'll achieve better outcomes. There's better follow-up. The patient has a more definitive plan. You'll keep patients at a higher level. There's a much higher retention rate, etc. So it's better for the patient. It's better for you. It creates a higher level of trust and accountability with the patient. Patients follow their plans when they truly understand them, which is why we do it this way with genomic testing. It improves their metabolic, their cognitive, and longevity outcomes. And again, all the steps moving forward, all the protocols and processes moving forward are efficient. They're automated. Genomics, quite frankly, creates long-lasting patient relationships. All workflows in one platform. In the genomic testing, there's clear interpretation of complex genomic data. It makes it user-friendly for anyone, a layperson, yourself, anyone can understand these clear action steps with a rationale in there, and then we get them started on the correct protocols, automated fulfillment and follow-up with zero staff burden, strong recurring revenue model built into your clinical workflows. So that's it in a nutshell. How we do genomic testing in this one platform for every workflow. If you have any questions about this or any questions about the DocLoop platform in general, please let me know. My email address is on this last slide, jpowell@docloop.com. I've been helping physicians like you grow these types of practices for 2 decades now. I've helped thousands of physicians and practitioners do this. I'd be happy to have a conversation with you. That number on there is my cell, 702-321-9716. I welcome a text if you want to set up a time to talk. I welcome a phone call. Weekends, nights, I don't mind. I'll take a few minutes, learn a little bit about what your practice is now, what your current and future goals are, how our platform fits into that. So please give me a call. I'll look forward to speaking with you. Thanks again.